it's on.
Right now?
You're good.
Good evening, everyone. I'm Daryl Steinberg, your mayor. I want to welcome you to another episode of Facebook Live here. I'm trying to do this 3 times a week at about 6 o'clock in the evening, just to have a chance to communicate with any of you who may be watching, to provide you some information about what's happening in Sacramento County and the city of Sacramento with the coronavirus pandemic, to fill you in on our progress on a number of fronts, and to give what I hope is helpful information about what you can do to protect yourself, protect your families, and protect the people of Sacramento during this unique time. I'm doing this 3 times a week, Monday, Wednesday, and Friday. And let me start with the fact that I'm a little sunburned here tonight. I was out with Governor Newsom earlier today in West Sacramento as the governor unveiled a new statewide approach to leasing thousands of motel rooms in California to help bring in people who are unsheltered and homeless. More of that in a few minutes. Let me give you an update here. Here in California, we now have 10,710 confirmed cases of COVID-19. 2,188 people are hospitalized and 901 people are in the intensive care units in California. Tragically, 250 people have died, including 31 just yesterday. Here in Sacramento, we now have 390 confirmed cases and 10 people have died. Now, the state modeling, which we're all following, and the national modeling shows us that the virus will peak sometime in California in late April or in early May. You may have heard as well the announcement today that Sacramento County schools will remain closed throughout the rest of the year. And so nobody expects that this is going to be over quickly, but it will pass, and we will in fact get through this together. And as I said in I hope a hopeful way over the last couple of times I've had the opportunity to talk to you, there is evidence here in Sacramento and throughout the state that we are doing a good job of following the state and county stay-at-home orders. And we are in fact flattening the curve. Now, it would be great if we could congratulate ourselves and say, it's over, we can go back to our regular lives. But as you know, the only way we're going to continue to flatten the curve is if we continue to practice the safe distancing that has become a hallmark of these last several weeks here in California. Once again, you only need compare what's happening in New York City, which started in the state of New York, which started later than we did, to see what happens if we let up in any way here. There is no guarantee, of course, that we are not going to experience more illness and more death, and the hospital surge that is already overwhelming hospitals and healthcare systems in other parts of the country. But we've got a decent chance if we just continue to do what we are doing. You may have also heard the announcement today by the state that the state has entered into an agreement with the Sacramento Kings and Sleep Train Arena to temporarily convert the Sleep Train Arena into the potential for additional hospital services and hospital beds. This is really an important addition to our surge capacity. Whether or not we actually need it in the end, we do not know. But we're taking advantage of the time, the precious time here, because of the fact that we started early to be prepared. I want to thank the Sacramento Kings especially for stepping up in such a big way. The state of California, the local community, the Natomas community, for doing the right thing and responding in the right way. We don't yet know whether or not we will need this for a Sacramento surge or a California surge. But even if it is For others in Northern California who are experiencing their healthcare systems being overrun, and not for Sacramento, let's all remind ourselves we're not just Sacramentans. We're Californians and we're Americans. And there was only one answer for the community, for the Kings, for all of us when the request was put forward. And that answer was yes, whatever we have to do, whatever we can do to help. So it is going to take several weeks for the Sleep Train Arena to be converted into a mobile hospital. But we have those couple of weeks, and we'll see whether or not we actually need it. But good work, everybody. Another great example of the Sacramento spirit. I want to talk a little bit about unsheltered homelessness on our riverbanks, under our freeways, and throughout Sacramento. This was a public health crisis before COVID-19. It is an elevated public health crisis during COVID-19. And if we do the right thing over the next couple of weeks, we may alleviate this as the same level of crisis it was before, once the COVID crisis is over. Why do we have such a great opportunity? Because the homeless population, we know, has the potential, because of the fact that people are vulnerable. They are less healthy because people who have been living out on the streets for a long time obviously have more fragile health. That if we don't get people indoors as quickly as possible, they could be rapid spreaders of the virus. Now, it didn't take and shouldn't take a crisis of this magnitude to motivate us to do better. And of course, in the city of Sacramento, we are already well on our way to create 700 new and repurposed beds within the city itself, in addition to what the county is doing. But now with this crisis, we can and must do more, and we must do more quickly. And so today, we celebrated, and it was just a modest celebration, the delivery of the first set of trailers that the state has provided to us out at the Cal Expo site. By the end of the day tomorrow, I'm told there will be 63 trailers that will house about 100 people. And first we seek to bring in those people from the existing shelter system who are symptomatic or who test positive. No one has yet, but if they do test positive, they will have first priority. But we are also prioritizing people who are at risk just by virtue of their age and or their underlying health condition. Early next week, the city and county will make a series of concurrent announcements, and we will meet in public session that will broaden this response beyond the trailers to a much more comprehensive response that will include motels, that will include expanding the size of some of our existing shelters to create more isolated space for those who meet the criteria that I described a moment ago, and to bring many more sanitary supplies and address the conditions of some of the tent encampments for those who we can't bring off the street. I expect that when this is all up and running, and everything around homelessness, in my view and in my experience, moves way too slowly, but it's also important to get it right, because we are standing up not only the sheltering of people, but what it takes to provide them food, the health and mental health services that they need, and maybe most importantly, to make sure that if we get people indoors in the four figures, over 1,000 people, and I believe that we can do that they don't return to the streets once this crisis is over, that we use this period of time, once they're in, to rapidly rehouse people, to ensure that that we permanently end the state of homelessness for as many people as possible. Now, statewide, we haven't not yet seen the huge spread among the homeless, but 14 homeless people have tested positive statewide, and one has died. And so time is of the essence. Stay tuned. Next week, there are going to be some big announcements. And we have the money to do this. The state of California, through the so-called HAP grants, the legislature and the governor, the city of Sacramento itself is getting $14 million. The county is getting significant resources. And then because of the federal stimulus resources, we're going to get millions more. On top of that, the FEMA, which is the Emergency Management Agency of the federal government, ruled this week that most of the money we spend on homelessness can be reimbursed at 75%. Now that may just be a financial transaction the way you think about it, but here's why it's important. The money we get reimbursed from the federal government, we can pour right back into the homeless problem and get more people off the streets. In some ways, in this terrible crisis, I have more hope than I've had in a long time that we can actually translate those hundreds of people we have gotten off the streets actually into thousands. My office has been getting lots of calls from constituents, of course, worried that they're going to get sick. I mean, it's a very common fear, and the anxiety that people feel, of course, is very real. We've talked about this before. If you're feeling anxious, if you're feeling a little bit down, if you don't quite have your balance, you're not alone, because most everybody is feeling this as well. And there's a lot of good reading out there about how you can comfort yourself, how you can focus on just the task in front of you at hand to try to reduce the anxiety, and maybe more important, take advantage of all these mediums that exist on the internet to connect with people in fun ways. But then there's another piece of this, and this is the whole question of how to do everything you can to make sure that you stay healthy. We know about frequent hand washing. We know about the physical distancing, which we've talked about, and it's embedded in the brain of every Californian and every Sacramentan. Over the last couple of days, the federal CDC has recommended, in fact, that when you are out in public, especially if you're in confined spaces like grocery stores, that you probably should wear some form of a cloth mask, even if you make up your own makeshift mask. And so this is important. I'm going to try to take this advice myself. But here's the thing. I spent some time with Dr. Pan today, our state senator, at a safe distance, and we were talking about this. And so if you're using the mask, a couple of things. Number one, you got to wash your hands before you put on the mask, because if your hands have the infection, you put on the mask, putting on the mask itself is going to get you sick. Secondly, once you have on the mask, if you fiddle with it in any way, you can only fiddle with it from the sides because you don't want to touch your face. And then when you take off the mask, and you take it off and you discard it, make sure that you wash it and then wash your hands again, because in taking off the mask, you're potentially exposing yourself. I'm no doctor, but the doctor gave me some helpful hints, and I passed them on to you. The other thing that's maybe most important about these masks is that they are not a foolproof substitute for physical distancing. They are not a substitute for physical distancing. They may help mitigate or reduce the spread, but please don't be cavalier just because you have a mask on and say, now it's okay for me to have a close-up conversation with somebody outside of your household. Let's shift to the economy for a minute. And there's nothing more heartbreaking, of course, than serious illness or death. And of course, that's why we're all doing this, to try to prevent more people from getting sick and dying. But let's be honest, there are a lot of people out in our community who are really hurting economically. I'm hearing the stories all of the time. And it's hard to believe. Just a few weeks ago, our economy was on a record roll, and now nearly 10 million Americans are out of work. It's stunning, and it is surreal. And so here in the city of Sacramento, we are working furiously to help people and organizations that have the ability to step up, and they are in fact doing so in an unbelievable way. The Donate for Sacramento Fund, which I encourage you to continue to donate to, has now topped $1 million in contributions. Yesterday, the city announced that 101 small businesses are the recipients of our forgivable zero-interest loan program, up to $25,000, 101 businesses. These include restaurants, retail stores, and daycare centers, all with 25 or fewer employees. And I love the response of Susan Hoyle, who owns the Strapping Boutique in Midtown. She said she's taken the money and she is using it to keep her employees on the payroll. Boom, cause and effect, no hesitation. I'm sure many of the other recipients will do the same as we try to keep Sacramento working. All over the city, people are adapting in creative ways to keep their employees working. But for those who haven't figured it out yet, I know our congressional offices, together with our Metro Chamber of Commerce, together with our Sac Asian Chamber and the City of Sacramento, are doing everything we can to provide assistance. And all you have to do is go to any of our organizational websites to provide assistance to small businesses who need help through either the Small Business Administration loan process, and that agency, of course, is overwhelmed, but we will help you navigate through it. And now Governor Newsom has announced for those who don't qualify for SBA loans, there's going to be a state program through the iBank, working with our private bankers, our commercial lenders, to help people with state assistance as well. You don't have to navigate any of this alone. Through the Metro Chamber, through the Asian Chamber, through the African American Chamber, through the Hispanic Chamber, through the Rainbow Chamber. There are a lot of resources here. Just call my office, call the City of Sacramento, go to one of the websites. We will get you connected. But as I said earlier, so many are just stepping up in creative ways. Our bars, our breweries, and our restaurants have switched their business to takeout and delivery. And Sacramentans, I know, are patronizing them in unprecedented ways. Please keep doing that. Rob Archie, who's the owner of Pangea and one of the recipients of our city small business loans, said one customer recently came in with envelopes for each employee, and in each envelope was a $100 bill inside. Now that's not a lot of money, but man, again, it shows the spirit, and that somebody would do that anonymously speaks a lot about the spirit here in our city. Some of our finest restaurants have repurposed their kitchens to cook for low-income seniors and people living on the streets. It's the Sacramento way. We're here for each other, and we're going to continue to be. But the scope of what we're facing, it's scary, and it is unknown. At the city, as you know, we've talked about it a couple of times, we passed a moratorium on residential and business evictions for people who can't pay their rent because of COVID-19. But I'm getting a lot of questions around, okay, so we don't have to pay our rent or pay less rent during the crisis, but what do we do after the crisis is over? What if we are still out of work and we cannot pay our back rent, much less continue to pay the rent that we owe? And so the laws we have passed thus far only deal with the period of the crisis. But I'm very attuned, and I know the governor is very attuned, the state legislature is attuned to the fact that the relief that is needed is going to be long beyond just the crisis itself. Whether it's in the form of direct rent subsidies, whether it's in the form of other stimulus dollars, including direct assistance to people, whether it's more small business assistance, or whether it is in fact to extend our eviction moratorium beyond the period of the crisis, all of these possibilities are top of mind, because we know that there isn't going to be a fine line in the stand when this ends, and everybody then is just going to have the money to be able to get back to normal. In the meantime, I really believe that the best way through this is, again, to rely on each other, to care for each other in every way that we can. We all need to be bigger than ourselves. So many generations that preceded us have faced their moment. And their moments have been around war, around natural disasters, around other things that have changed the country and have changed the world. I've said a couple of times that in my generation, we never had to go to war. And it makes me appreciate even more the sacrifice of the men and women who serve our country so selflessly. But this is our moment. And we will define how future generations think about us and what we did during this time by how we act and what we do, and whether we keep our spirit and our sense of community throughout this most difficult time. There are lots of ways to help. You can volunteer by visiting our local handsonsacramento.org website or the state volunteer website at serve.ca.gov. Today, the governor talked in his daily briefing about the fact that 75,000 healthcare providers have signed up for the Health Corps to volunteer, and they will get some small stipends, I'm sure, but essentially to volunteer in any part of the state where they are needed. I know a lot of Sacramentans have signed up as well. I love the story that I heard today about Adam and April Doherty. Adam is an emergency room physician at Sutter, and April is a supervising nurse at UC Davis Med Center who is leading the effort to help educate the hospital personnel about the use of personal protective equipment. They also have a 5-month-old daughter, Dylan. And what they are doing, and I'm sure their story is not unique, they're having to match their long shifts, daily shifts, to address this crisis while at work and shifting at just the right time so one of them can take care of their 5-month-old daughter. This is the kind of thing that is going on through households throughout Sacramento and throughout California. Whether it's the fact that parents are now having to essentially become the homeschoolers and teaching while juggling work shifts, people are really doing above and beyond and not complaining about it along the way. I hope everybody has a restful weekend. I know it's supposed to rain, but maybe I'll put on a hood and a mask and get out and get some fresh air and take a walk. Please stay safe. Please stay indoors as much as you can. Please look out for one another. I look forward to talking to you on Monday. Thank you.